Hello friends, welcome to a new question. 40-year-old homeless man presents with 2 months history of fever, purulent. 40-year homeless man presents with 2 months history of fever, productive cough, occasional hemoptysis, soaking night sweats and weight loss. Physical examination shows apical rails. His radiograph is shown in the figure. What is present in the right lobe? Here if you see, this is a cavitation which is seen. See, this is a cavity which is formed in the right lobe. So what does the sputum sample show? Sputum sample shows acid fast bacteria, most probably Mycobacterium tuberculosis. Why does this patient has systemic symptoms like fever, night sweats, weight loss? This is due to the tumor necrosis factor and interleukin 1 which are released from the macrophages. Thank you for